Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vaccination.
And you have yet another success story
just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show. I have a special guest on today who also happens to be my best friend who's a fertility doctor in Los Angeles, Dr. Catherine DeUgarte. Welcome, Catherine.
Thank you, Amy. And it's always a pleasure to be with you, especially on your birthday. Happy birthday.
Thank you. Well, it would be really weird to say I'm so excited to talk about COVID-19. I'm just excited to talk about you, and I know you're going to do a great job educating us about COVID-19. So let me tell our followers a little bit about you. You're a reproductive endocrinology and infertility specialist, medical director at CMD Fertility. You can find Catherine at cmdfertility.com. You're also assistant clinical professor, UCLA Department of OBGYN. And we're going to talk about preventing COVID-19 on the journey towards conception. So Catherine, let's get started. Tell us about COVID-19. What are the facts that people should know?
So unfortunately, COVID-19 has affected all our lives for the past year, and everybody has had an impact more so the infertility patients specifically that we deal with every day, not only have to stress out about their fertility journey, but now they have to figure out how to prevent getting this horrible disease and their babies from getting it. And so it is something that's very important, and I get asked questions about it every day.
And who is at risk?
Anybody can get COVID-19, especially if you're not vaccinated. It's a respiratory disease that's caused by the infection of the coronavirus or the SARS-CoV-2 virus. It can be transmitted through respiratory droplets from person to person. And the good thing is right now, there's many ways to test for it and there's ways to prevent it. A year ago, we had no vaccines, and now there's 6 vaccines available in the world and 3 in our country.
And then what kind of symptoms should people look out for that might be a sign that they might have it?
So the most common symptoms are fever, shortness of breath, and coughing. However, there's some specific symptoms such as loss of smell, and there's also GI symptoms that patients can present with. And symptoms can appear 2 to 14 days after exposure. And the problem is that patients can be asymptomatic for 14 days before symptoms can appear, but they can still transmit the disease during that time.
Yeah, and what should pregnant women know? Are they at risk for more severe illness compared with non-pregnant women?
So a year ago, when COVID first started, we were telling patients that we have no idea if COVID affects pregnancy. But now there have been many studies that have shown that pregnant women can have more severe disease. There's been studies that they have increased ICU admissions, need for ventilation. Unfortunately, they're higher risk of death. And they're also higher risk of pregnancy loss. There's been several studies that have showed that. And a recent study that actually came out last week in JAMA, which is a very important article, showed that in 2,000 women, 700 of which had COVID, from 18 countries that they studied last year from March to October, and had COVID positive confirmation on their labs and at least 2 symptoms of COVID, they had an increased risk of problems in pregnancy, such as preeclampsia, where they get high blood pressure in pregnancy, severe infections, ICU admissions, maternal mortality, and preterm birth. The babies also had increased risk of morbidity and mortality, and this is the first time a study actually showed that in a clear fashion.
And what kind of things can someone do to prevent getting COVID?
So the most important thing we can do right now is social distance and wearing our masks, as well as whenever we can to get vaccinated. So we're lucky, again, that we are able to have 3 vaccines that are available in this country. There's the Pfizer vaccine, the Moderna vaccine, and the Janssen or the Johnson & Johnson vaccine, which was initially paused for a few weeks, but recently started as of yesterday. They met and they decided that the benefits outweigh the risk, and now it's back to be available to patients to get it as well.
So you mentioned the JAMA study and some of the things that it told us pregnant women could be at higher risk for. What are specifically the different diagnoses and what is the actual risk?
So the risks from the actual COVID-19 in pregnant women, they were admitted to the intensive care unit more. They had a higher chance of infections and preeclampsia, which is a high blood pressure in pregnancy, preterm birth, and also their babies were at higher risk of dying, unfortunately, after delivery. And they showed that with cesarean section, you can have an increased risk of giving your baby, but not with breastfeeding, which I thought was interesting.
Let's just take one of those things like ICU admissions. So how much higher is your risk if you're pregnant versus not pregnant?
So in this study, the risk of ICU admission was the relative risk was 5 times higher. So 5 was the relative risk for these patients. So definitely a much higher risk of ICU admission. And once you're admitted to the ICU, then you get exposed to all the other diseases. You could get pneumonia and other infections. Once you're ventilated and intubated, then there's less oxygen flow to the baby, and the baby can have preterm labor. And so once patients are placed on the ventilator, much higher chance of dying as well.
And you mentioned in this country we have access to 3 different vaccines. Is there one that you recommend to your patients over another?
So personally, I tell them that whenever they can get the vaccine, the soonest, the better, especially before getting pregnant. From my personal experience, from having had many of my patients, I would say at this point, about 80% of my patients have been vaccinated. And I always ask them how they felt afterwards, any side effects. What I've seen personally, and again, this just from my own experience, is that with the Pfizer vaccine, they've gotten the least amount of symptoms. With the Moderna vaccine, more people have gotten flu-like symptoms and severe pain at the injection site, but they're both very effective. They're equally effective in terms of preventing COVID-19. With the Johnson & Johnson vaccine, they did have 7 patients that developed blood clots, and that's basically our patient population. It's women 18 to 49, which is mostly, well, really, we see over patients over 40, but it's really the women over 18 that showed the blood clots. So if they have a preference, if they have a choice, I would say Pfizer and Moderna over the Johnson & Johnson. But if you think about it, 7 patients developed blood clots out of 7 million. So many people prevented COVID by taking the Johnson & Johnson vaccine, preventing death from that reason. So in a way, it saved lives. So benefits outweigh the risks.
And we have all these societies out there like American College of OBGYN. What are the recommendations that ACOG is making when it comes to COVID vaccine and pregnancy?
So there's recent recommendations from ACOG that says that vaccines should not be withheld from pregnant women, and they should be offered to lactating individuals with the hope that they build antibodies, the babies. And also, they're now tested in pregnant women. However, the pregnant women were not included in the original studies. And there's unfounded claims linking infertility to the COVID vaccines. I don't know about you, but I get a lot of my patients who tell me, well, I've heard that the vaccine causes infertility. And I don't believe in that. There's no studies on that. ACOG doesn't believe in that. ASRM doesn't support that. So I think there's unfortunately a lot of theories out there about that. I don't believe in that.
I'll call those myths. I would say they're myths out there. Yeah, definitely. So can you break down the mRNA vaccines, both Pfizer and Moderna? Like, what is messenger RNA and how does it use our own body cells to fight COVID-19?
Absolutely. So, the 2 different mechanisms, mRNA vaccines are new to us. The technology has been around for a while, but it hasn't been used in a vaccine. And this vaccine was developed quite rapidly because of the prior research that was done. And the messenger RNA is basically encapsulated by a lipid nanoparticle. And so these lipid particles help deliver this mRNA into our cells, into host cells. And then they utilized our own body cells to generate the coronavirus spike protein, which is the protein that then stimulates the immune cells to create antibodies. So it kind of fools our body into thinking that we have COVID, so it makes antibodies against COVID. What's important to know is that these vaccines are not a live virus, so you can't get COVID from the vaccine. They don't enter the nucleus, they don't change our DNA, Again, there's no studies on pregnant women because they weren't included in the initial studies. But since then, they're being followed. There's many pregnant women that have received the vaccine. In terms of the mRNA vaccine, the efficacy for the Pfizer one has been shown to be 95%, for the Moderna about 94%. And they've also been studied in diverse sex, age, race, and ethnic categories, as well as those with underlying health conditions. The Johnson & Johnson or the Janssen vaccine is an adenovirus vector vaccine. It's a monovalent vaccine. It has a recombinant replication of basically the human adenovirus vector, and that also makes the spike protein, just like the mRNA. However, it doesn't have the special particles to get in. So for patients with allergies, since it doesn't contain preservatives, it may be better. It's also not a live vaccine, and it doesn't replicate in our cells.
And then how effective are the vaccines in preventing, let's say, moderate, severe, and COVID symptoms or illness and preventing hospitalizations? So
in the initial outcome studies for the Pfizer and Moderna, they looked at overall effectiveness against COVID, which were around 94, 95%. With the Johnson & Johnson vaccine, they looked at specific categories. For example, it ended up being 67% effective at preventing moderate or severe COVID disease, and 77% effective at preventing severe COVID illness. And what's most important is that it prevented 93%, it was 93% effective for preventing hospitalizations, even 2 weeks after the vaccine. And again, it's given as a one dose, so you don't have to have a second dose, which is one of the big advantages of the Johnson & Johnson. Again, the problem is the blood clots, which we had talked about. And just so people know, I've had several patients that have gotten the vaccine, and what I've told them is, since the pause happened from the FDA, is to look out for symptoms such as headaches, chills, fever, back pain, trouble breathing. And now that they've released it back into the market, women under 50 who've gotten this vaccine are now given a handout which shows that it can increase a rare blood clotting disorder, which cannot be treated with heparin because it's also associated with lower platelets.
How many people have gotten these vaccines total in the US?
So at this point, I would say that the Pfizer vaccine, it's more than 10 million doses. The Moderna, it's more than 7.5 million doses. The Johnson & Johnson, because it was released later than the other, I'm not aware of how many total have been given, but it's approximately 7 million is what the report was right before the pause.
I want to go through some vaccine myths. Myth number one, the vaccine was rushed and it isn't safe. What is the vaccine fact here?
So that was one of the most common reasons why my patients have declined the vaccine. I think they say it was done really fast. But again, the technology has been around for a long time. It was actually a woman who first discovered the mRNA technology many years ago, but nobody believed her. And so when this happened, there was some work in a few years ago with Ebola and trying to work on those vaccines. And now they had the technology already. They just basically tried it. And they enrolled patients really quickly, and they were able to get the information to the FDA rather quickly. So again, they didn't take any shortcuts. And so far, the studies that are out there show that the vaccine is safe.
And another myth, it can give you COVID-19. Like I've had patients say, well, I'm about to have my egg retrieval and I just got the vaccine. I'm worried I'm going to be positive.
So the vaccine can't give you COVID-19. However, if you get the vaccine today, and if you happen to be exposed to somebody tomorrow who has COVID, you could get COVID. And so that person might think, oh, the vaccine gave me COVID, where in fact they got it from the person the next day, but they didn't have antibodies yet to prevent it.
Another myth, that if I'm allergic to eggs, I can't get the vaccine. Is that true?
And that's a good question, because with the flu vaccine, as we all know, you can't take the flu vaccine if you have an egg allergy. You can take a version of it, but not the one that everybody else takes. And this vaccine does not have any egg protein, so it can be given to those with egg allergies.
I want to talk about some vaccine considerations, and a lot of these things are questions that a lot of my patients are asking me, so I'm super curious, and I'm glad you're here to answer these questions. So should women who experience fever following vaccination be counseled to take Tylenol?
Absolutely. It is very safe for women to take Tylenol in pregnancy and does not impact the antibody response to COVID-19. But I would advise them not to take a Motrin.
And should someone who finds out they're pregnant after their first shot, if they got Pfizer or Moderna, should they still get their second shot in pregnancy?
It is recommended by ACOG that women should continue and complete their 2-dose series even if they're pregnant. However, if possible, to get both vaccines before attempting pregnancy, that would be ideal.
And then there are other vaccines that are recommended in pregnancy, like Tdap and the flu shot. How should you time your COVID vaccine to the other vaccines that are recommended in pregnancy?
So ACOG recommends that if you are giving other vaccines, such as Tdap or the flu shot, you should wait 14 days after giving the COVID vaccine.
And for women who, let's say, are Rh negative and they need RhoGAM in pregnancy, is there any special consideration for them when it comes to timing the COVID vaccine?
And that's a great question. With RhoGAM, you don't need to wait the 14 days, so you should give it as needed to patients, for example, who've had miscarriages, or if they're 28 weeks, you should not delay that because you don't want to have a problem with a baby.
And then I want to know one more time, and I want to hear you say it, that the COVID vaccine, does it cause infertility?
So at this point, there's obviously no studies showing that the vaccine causes infertility. Obviously long-term studies are not there yet, but from what I've seen with my patients, I've had many patients who've gotten the vaccine and have gone through procedures and have gotten pregnant.
And ASRM has, given out a fact sheet basically about vaccine considerations as well around reproductive care procedures like egg retrieval, transfer. Can you talk a little bit about that?
Sure, and that was actually a recent guideline by the ASRM, and it basically stated that patients who are undergoing fertility treatment and pregnant patients should be encouraged to receive the vaccination based on their eligibility criteria, and that they don't need to delay pregnancy because of the vaccination or defer treatment until the second dose. And they also state that there's no evidence that the vaccine can lead to the loss of fertility. And this is the important one that I've gotten a lot of questions about, is when to do the vaccine while they're undergoing an IVF cycle. And what ASRM recommends is that you should wait 3 days, either before or after. So if you have your retrieval scheduled for Saturday and today's Monday, that's a great time to get the vaccine. So at least 3 days should go between the day of the retrieval and the day of the vaccine, and not because the vaccine is going to cause a problem with your eggs or anything. It's just that you can get a fever from the vaccine. And so if you get a fever from the vaccine and it's happening the same day as the retrieval, you don't know if the fever is an infection from the retrieval, and so you have no idea how to treat that. So you don't want to mask underlying an infection.
And what about the ERA test? Do you think that the vaccine would impact ERA results? What do you tell your patients?
I don't think it makes a difference. But again, I think if just because of the fever issue, just because it can cause pain when you do the ERA procedure, I would say I would wait 3 days before any procedures just to be on the safe side.
And what about mammograms? I mean, we recommend mammograms for people in certain age groups, but especially reproductive age women who are, let's say, 40 and planning a cycle. A lot of times people recommend a mammogram before they start IVF. What should women do when it comes to the vaccine and their mammograms?
And in fact, I recently had my mammograms, and that was one of the questions that they asked me is, have you had a recent vaccine? And I asked them why before I actually looked it up myself. And I read that there's a recent guideline that showed to avoid mammograms 4 to 6 weeks after the vaccine because it can increase the size of your lymph nodes. And since the vaccine's given in the arm, the lymph nodes that are getting enlarged are the ones near the breast area. And so they would appear like you have an enlarged lymph node, which could be a concern for possible cancer. And so it would go down this pathway of freaking people out. So I think it's best to avoid 4 to 6 weeks afterwards.
And then what about for folks who've already had COVID? So I have patients who've been exposed to COVID, they're positive, and I'm still recommending the vaccine. Is that something that you're doing as well?
I still recommend the vaccine again, especially if they're trying to get pregnant, because the immunity is thought to wean after 3 to 6 months. I don't recommend getting the vaccine very soon after getting the diagnosis of COVID, but they are recommending about 3 months afterwards.
And do you think that we're going to need a booster shot? And if we do, when do you think that's going to be needed? And when do you think that's going to be needed?
So some folks from the CDC are saying that because there's so many new strains out there, and it seems like the virus is changing its course. There's new strains from Europe and Africa and Brazil, and so some of the initial studies tested a few of those strains, but not all of them. And so the thought is that we may need a booster, just like we get annual flu shots. We may need to get an annual COVID vaccine, or we all may need a third booster shot in the next 12 months.
And what are you doing at CMD Fertility in your own clinic?
So what we do is we don't make all our staff get vaccinated, but I was lucky that they all volunteer to get vaccinated. So that makes us all feel better, and our patients are safer because we're not going to spread the disease. We're all wearing masks. We're not allowing at this point partners, unfortunately. That's really heartbreaking, especially when they have their first heartbeat ultrasound. So we're trying to not allow them to come in unless they have to provide a sample. And also we are giving them questionnaires before they come in. We check everybody's temperatures. We do extra cleaning. We have air purifiers. And we do check everybody for COVID who has not been vaccinated within 5 days of their procedures. We're also spacing patients out and not allowing anybody to wait in the waiting room, so that decreases their chance of getting it.
Did you ever think that you and I would do a COVID and fertility talk together ever?
Never. My grandfather, a virologist, I wonder if he's up there smiling, but I always wondered why he became a virologist. And he said it's such a small particle, but it's very powerful and it can affect the whole world. And now I realize that he was right all along.
Well, thank you, Catherine, for shedding light on such an important topic for us today. And I wish you all the best and best of luck. I hope all your patients' eggs and sperms and embryos sparkle.
And let's all stay healthy and get through all this together.
Thank you again.
Have a lovely day. Bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vaccination.
And you have yet another success story.
Just launched by an East Bay fertility doctor.